alcoholism has almost nothing to do with alcohol, and drug addiction has almost nothing to do with drugs. Does this sound crazy? Maybe, but the honest truth is, what's crazy is that there is a way to recover from addiction, and because of the misunderstandings and mistruths about what addiction is, we are not recovering and we are dying. So stay with me here, because what I want to do is firstly explain very clearly what addiction is and what it isn't, and then that it's very kind of straightforward where we go from here, how we can save many lives. So please do, if you want to learn about it and learn how to save lives, hit like, subscribe, share right now, and we're going to dive right in. So what is addiction? Addiction is a symptom of complex childhood trauma. And what happens is you have a highly sensitive soul, complex childhood trauma. The brain in the fundamental years learns that it is not safe. And there is this kind of whole pain deep inside that's held down. Now, lots of other factors can attribute to what this trauma is, little t's or big T's. And then lots of other things can happen that can activate it later in life. Like, I thought I had a perfect childhood, and I found out later when I dove in that I didn't have a perfect childhood. I had complex childhood trauma, and that was at the core of my addiction. And I could work to do the inner work and resolve that and get better for life and help the lives of others. So it's so important that we understand that it's complex childhood trauma at the heart, that it's this deep pain, that any addictive behavior is pathologically self-soothing, and we can resolve that by doing the deep work and understanding where that pain came from, what it is, how we can change it and heal it, and then nurture mind, body, and spirit, and come together in tribe. Because it is true, the opposite of addiction is not sobriety, it's connection. But it's not that simple. That is a gross simplification of the neuroscience. But when we do understand that there is a change in the neurology of somebody who is an addict, so the DSM-5 is the clinical definition from the American Journal of Medicine. And from there we can understand how much the neurology has shifted in terms of basically a normal, like, non-drinker, non-drugger, compared to somebody who has significant complex childhood trauma and has deep in addiction and active addiction. The brain scan is very, very different. So we have this fundamental shift in the neurology, so it is a disorder that needs to be treated. Up until now, we've been treating the symptom and not the wound. We're looking at the drinking problem and the drug problem. Yes, that has to be addressed, but we need to not just treat the symptom, we need to treat the wound. We need to look at the deeper problem, resolve that, which we can do, I'm going to simplify it here, through deep psychological work, somatic work, and just having a recovery strategy and a plan. You can't recover in 28 days in a rehab, but you can get sober in a rehab, you can have a strong why, and you can nurture mind, body, and spirit to create a better life, a transformative life, and be like me, a grateful alcoholic. Like, because of almost dying in alcoholism, I'm really grateful for who I am and and my life and everything that it's become, and that's because of this disorder. So there are lots of positives, and that's a whole other video. But for now, we need to understand. Gabor Mate is the expert on this, and Dr. Reshi Joseph also. But understand that addiction is about complex childhood trauma, and the problem at the moment is that we're treating the symptom and not the wound. We can treat the wound as well as the symptom as well, because that needs to stop in the short term. But the problem at the moment is, because we are only treating the symptom, the raw problem, it's like if you just treated a rash but not where it was coming from. It fixes itself up for a few weeks, or in the case of addiction, a few years, but then we go back and we keep going in this cycle. And this is how so many people die, because we treat the symptom and not the wound, and people keep dying. So we need to look at treating the wound, getting deep psychological care, working with specialists, having a year-long plan to change neural pathways, understand working with the nervous system, find safety in the body, and people can recover for life. Game changing. If the rehabilitation centers work differently, if people are more open to just not, there is no quick fix. They're going to commit to it for a year, change those neural pathways, work with the body, create a better life for yourself, get into community and get into tribe, and you can recover for the long term, and all of society will benefit. Because for every addict who suffers, who passes away, there is a whole ecosystem of people that are hurt through that. And it's also a result of societal trauma and the breakdown of families and bonds. Whole other video on that. But for now, let's just understand what the truth of addiction is. That's very little to do with the drinks and the drugs. And please do share, comment, like, get this out there, and let's change the conversation and change how we treat this.